Hi, my name's Vanessa, and I am a pediatric speech language pathologist with over 12 years of experience working in the field. I have worked with infants all the way up to adolescents to the age of 18 years of age, and I primarily specialize working with those children and teens with complex communication needs. I have specific training in providing AAC, so augmentative communication. I have worked with populations such as Down syndrome, cerebral palsy, autistic individuals, and medically complex. I have also had certifications in apraxia as well. I have been fortunate to work in a variety of settings. I have worked at Alberta Children's Hospital. I have worked in the schools. I have worked on a school out on a reserve here in Canada, which has been a very enlightening and very humbling experience. I have also worked in a community. I've worked in people's homes and I've worked in private practice as well. And I specifically work with children. I have done a little bit with adults, but my passion is working with children and families. I have worked with children with a variety of different conditions, neurological, um, as well as medically complex and fragile. I completed my undergraduate degree at the University of Guelph and received a Bachelor's of Applied Science with specialization in family relations and child development. And then I went on to complete my Master's of Clinical Science at the University of Western Ontario with a specialization in communication sciences, speech language pathology. I am also registered um, with the Alberta College of Speech Language Pathologists here in Canada. I also have certifications in PROMPT, which is for apraxia. I have certifications for POD. I also have certifications in SOS training, which is feeding. And I also have Kaufman and Hannon It Takes Two to Talk as well. I always seek opportunities to learn and grow. And I am specifically drawn to work in Australia because of its focus on evidence based practice, on early intervention, and equitable access to services and care, as well as its focus on holistic um, child or family centered care and belief in multidisciplinary teams. I also have a strong passion for providing care to underserved populations, such as First Nations. And I know that Australia is also making gains towards providing and bridging the gap for services for their First Nations population as well.